I remember learning about Erika's passing like it was yesterday, being at school, hearing rumors and vague comments about what had occurred. But it was clear from the start, the school had no idea how to speak, behave, or foster meaningful conversations around mental health, depression, and especially suicide. But losing Erika was the impetus for change. From the very first days, there was an overwhelming feeling of community and togetherness. We all joined to mourn, talk, and educate. We knew that this was the time to get depression out of the dark. What began as attending vigils quickly turned into developing mental health-focused programs for our education systems.
I don't remember who told me or how I was approached about joining a teen panel, but I do remember meeting in the Washburn Library weekly with bright colored poster boards discussing depression. We discussed our emotional needs, our concerns, we grieved, and asked honest questions that we had about depression. It was a handful of us that had the privilege to talk openly about something shocking that had just happened in the community. But we also knew that that privilege did not belong to us. It belonged and still belongs to everyone.
And that was our next task, sharing what we were learning with the whole school. We set out to ensure everyone in the school could have open, honest dialogue about mental health. We were determined to normalize these conversations about mental health. We started with educating our friends. We worked to guarantee our teachers and mentors were trusted adults, and we also helped educate our parents and our families. In our goal to prevent this from ever happening ever again, we knew it would take everyone working together and using the same shared values and vocabulary. What we found during the process was inspirational. We learned that young people are hungry for this conversation. They wanted to talk about mental health, and their voices made our work even more effective.
That mission continued as we went to high school. We named ourselves the Stigma Busters as we fearlessly, although I do remember being extremely fearful about sharing true stories of our own mental struggles, with the purpose of shedding light on real young people, our peers, that were not afraid to share experiences with mental health. It was unbelievably empowering. So empowering that in 2021, I heard from someone I went to high school with. He said, "I know we didn't know each other, but I remember you saying something about your own mental health struggles on the teen panel. I found it comforting and I felt less alone." A statement made by an Erika's Lighthouse teen panel member resonated 17 years after it was made. And that is the power of Erika's Lighthouse.
While Erika's Lighthouse was born from loss, we are alive by action. We have spent the last 2 decades working to make sure no one feels alone in their depression. We are transforming school cultures across the country, just like we did at Washburn and New Trier. We are reducing stigma, normalizing conversations, promoting good mental health, and encouraging help seeking.
And in our efforts, we're not just empowering youth in our schools today, we're also inspiring young people to take charge of their mental health. We're educating them to support their friends, their families, and their communities. And there's maybe a chance that one day, just like me, they'll become mental health professionals dedicated to ensuring that every child knows that they deserve good mental health.